focused on the Ziehl Neelsen stain, acid-fast organisms, mycobacteria, nocardia, cryptosporidium, and treatment approaches based on the provided text. Question 1. Diagnostic staining. A 40-year-old man with HIV presents with chronic cough, night sweats, and weight loss. A sputum sample shows slender, red, rod-shaped organisms on Ziehl Neelsen stain. Which component of the bacterial cell wall is stained by this technique? A. Lipoteichoic acid, B. Peptidoglycan, C. Mycolic acid, D. Lipopolysaccharide, E. Teichoic acid. Correct answer C. Mycolic acid. Why? Ziehl Neelsen stain carbofuchsin stains mycolic acids in the waxy cell wall of acid-fast organisms like Mycobacterium tuberculosis. A, B, D, E. Incorrect. These are found in other bacteria but not responsible for acid fastness. Question 2. Alternative staining for screening. A hospital uses auramine-rhodamine staining instead of Ziehl Neelsen stain in tuberculosis screening. What is the primary advantage of using the auramine-rhodamine stain? A. It stains bacterial spores. B. It is more specific than Ziehl Neelsen. C. It stains the bacterial capsule. D. It is more sensitive and cost-effective. E. It differentiates between gram and gram-pap bacteria. Correct answer D. It is more sensitive and cost-effective. Why? Auramine-rhodamine is a fluorescent stain used for screening acid-fast bacteria such as Mycobacterium tuberculosis. It is cheaper and more sensitive than Ziehl Neelsen. A, C, E, unrelated to acid-fast staining. B, Ziehl Neelsen is more specific, but auramine-rhodamine is preferred for initial screening. Question 3. Nocardia identification and treatment. A 55-year-old male with a history of chronic steroid use presents with cough, fever, and cavitary lesions in the lung. A modified Ziehl Neelsen stain of the sputum shows weakly acid-fast filamentous branching rods. What is the most appropriate treatment? A. Isoniazid and rifampin. B. Vancomycin. C. TMP-SMX. D. Azithromycin. E. Metronidazole. Correct answer C. TMP-SMX. Why? Nocardia is a weakly acid-fast, branching, filamentous aerobe that causes pulmonary or CNS infections, especially in immunocompromised patients. First-line treatment is trimethoprim sulfamethoxazole, TMSMX, A used for Mycobacterium tuberculosis, B for gram cocci, D for atypical pneumonia, not nocardia, E for anaerobic protozoa or bacteria, not acid-fast organisms. Question 4. Cryptosporidium infection. A 5-year-old boy with recent travel to a developing country presents with watery diarrhea for 2 weeks. Stool microscopy shows acid-fast oocysts. Which of the following organisms is most likely responsible? A. Giardia lamblia. B. Entamoeba histolytica. C. Cryptosporidium parvum. D. Strongyloides stercoralis. E. Escherichia coli. Correct answer C. Cryptosporidium parvum. Why? Cryptosporidium oocysts are acid-fast and identifiable on Ziehl Neelsen stain. Causes chronic diarrhea in immunocompromised and prolonged watery diarrhea in immunocompetent hosts. A, B, not acid-fast. D, diagnosed by larval visualization. E, not diagnosed by acid-fast stain.